Hey, all right, welcome to another video. This is a shoulder surgery update. I had surgery yesterday. That was Thursday, today is Friday. I'll put this on in the morning, Saturday morning. I have to edit it after I get done here to get it so it looks okay. So the surgery went really great. They were just very professional people down there. I bet they asked me 8 or 10 times. So your name, birth date, what are you having done? And so I'd always tell them shoulder surgery. And they say, okay, you passed the test, so to speak. So the doctor initialed my arm and everything, so that it was definitely this shoulder. What they did was the rotator cuff was a little jagged on part of it. I don't know if it got broke or crumbled or what, but there was also bone spurs. And they shaved down the rotator cuff, and they whacked off the bone spurs, and one bone they had to plane down or whatever, they buff down or something. They said that would be the most sore part because they're rubbing out the bone. But they got it all done. They also cut the bicep, part of the bicep, and they pulled a tendon out. They apparently had it outside of the arm, and they drill a hole in the end of the bicep and put a button on or something. They sewed that, and then they put it back in, sewed that together. Sounded like quite a process. They definitely knew what they were doing. Then they sutured it all up, bandaged it. It's like 2 or 3 layers of bandages on here. And they put a nerve block in. The nerve block, they had me look, before they started, they had me looking at this ultrasound monitor, and I could see the muscle tissue and the veins. And then they said, we're just going to put in the blocker now. So I felt this little prick, and they put the needle in. You could see the needle going in. That was pretty cool. And then they wiggle it around. That hurt a little bit. But after that, I couldn't feel anything. Numbed my arm right up. It also numbed the muscles, the diaphragm muscles to this side of the lung, so it's still hard to grab a good breath of air, but that will wear off within 48 hours, I guess. But my arm is already, I can move it. It was, last night I'd look at my arm and I'd tell it to move, it wouldn't move. It was just like, because the nerves were gone, it couldn't tell my brain move. So this morning it's fine. It doesn't even hurt. I'll take this off. Around the house I don't have to wear it. Just let it dangle, and it hurts less than it hurt before the surgery. So that is a huge plus. I'd appreciate it if you would subscribe. We do garages. That's our specialty. And hit the like button, and feel free to leave a comment. Monday, I hope Monday I'll have it ready, a video on the options for a ranch-style garage. There's so many choices to choose from because each garage is tailor-made to whoever wants the garage. We can add, there's a certain price for going from an 8-foot ceiling to a 10 to a 12 and so on. 14 is about the highest we do. That will fit a car in, or with a lift, or an RV, things like that. Or change from a 2x4 to a 2x6 wall. What else? If you want a garage door opener, or if you want an extra window, extra door, garage door, different size garage door. There's a lot of options out there of what to do. So I printed it up on a couple of pages. I'll try to get that on there so that you can take a snapshot, a picture of it with your phone or whatever. I think that's about it, but I really am encouraged. I think they said it's a 2 months recovery time for this. I'm not, well, if they say I have to wait, I'll wait. But probably within a month, I'll be able to start lifting things. I probably can't swing a hammer for a bit. But we already have garages. We have to start building in the shop and get going for the season. So pretty excited, looking forward to 2021. Should be a really good year, I think. I think we're around the curve of all this, I hope, of stuff that's been going on the past year with the COVID. So thank you very much for watching. I'll have another video out soon. See ya.